And one of the first challenges in treatment when you have a 19-year-old is you have a small window to catch their attention. And whether the disease model is right or wrong isn't the point. If he doesn't believe in it, you better approach it from a different angle, because he will not live long enough to realize you are right or wrong. And I'm speaking from a former 19-year-old's perspective. And I argued my point, and they dismissed it, and it is what it is. And I learned a couple other things, because a portion of a Minnesota model is heavy abstinence-based. I work an abstinence-based program of recovery today. What is abstinence-based? It means there's no drugs or anything. And I remember kind of casually mentioning, I was there for a cocaine issue, and I remember casually mentioning that, man, when I get out of here, I'm going to have a couple beers. Anybody that's ever never been in treatment, don't say I'm going to have a couple beers when I get out of rehab. It does sound kind of nutty. And they said, well, you can't do that. And I go, well, what do you mean? And they go, well, you can't do nothing. And I said, nothing? And like, nothing. You're an addict. And I go, yeah, but I'm not here for drinking. Like, look in my file. Look in the file, right? And they're like, no, you can't do nothing. And I'm not telling you that I'm encouraging a 19-year-old to drink. I'm telling you what a 19-year-old who has found himself in the grips of opiate addiction will hear when you blast him with you're an addict and everything is off. Because when I said, what are you saying I can't smoke weed? No, you can't smoke weed. But why? Because you're an addict. But I'm not an addict to weed. You're an addict, you can't use any. But yeah, but nothing? Like you're saying I'm like, sell my butt on the corner for a bag of weed, like I'll go crazy? You just can't do nothing. And it didn't make sense to me, and it doesn't make sense. Why? I came here for cocaine, please help me. And I raised my hand, and they're like, David, what? How come we can drink coffee and smoke cigarettes? Yesterday's group, you said nicotine is a stimulant and coffee is a stimulant, and I'm here for stimulants. According to your thing, I should be like addicted. I should be gallons of coffee. And they're like, it's different. How is it different? It just is. And I'm struggling and I'm trying. I am there because I know there's a problem. I'm not an idiot. One of the biggest mistakes that people make is they assume that if the kid didn't make it, it's because he wasn't willing. There is a difference between unwilling and not agreeing.